Hi, I'm Dr. Randy McVeigh. I'm a general dentist from Garden City, Kansas. I would like to talk to you just briefly about toothbrushes and toothbrushing. Now, what are we trying to accomplish when we brush our teeth? It may depend to a certain extent upon your motivation. Maybe you're motivated by social reasons because things look better and smell better when you brush. Maybe you're motivated by health reasons. You want to minimize the risk of cavities, subsequent fillings, periodontal or gum disease. No matter what your motivation is, the goal is always the same. It's to remove as much of the bacteria, plaque, and biofilm. That's the goop and goo that those bacteria make that forms on your teeth. And if you think about your teeth, they are not straight lines. There's lots of little grooves and crevices and places where those bacteria can grow. And in between the gum and the tooth, right in here, there's a space, just like there's a space between your fingernail and your cuticle. Next time you eat potato chips or crackers, before you rinse your mouth out, go look in the mirror, and I think you'll see that right along the gum line is where those crumbs tend to accumulate. So the bacteria that grow in that space have lunch ready and available. Okay, so what kind of brush is going to accomplish this best? Well, I went to our local Dillon's, our local grocery store. I got a firm brush, a medium brush, a soft brush, an extra soft brush, and just for fun, I got an electric brush, a Philips Sonicare. Okay, so first we're going to talk about the firm brush. What we want is for those bristles to bend and go in between the spaces between the teeth. And I think that you can see here that these bristles really are just a little bit too stiff. They don't really go in between the teeth much at all. So they miss a lot of those surfaces. The medium brush does a little better job. It gets a little closer, but it still misses a lot of the tooth surface. A soft brush is going to do a much better job of letting those bristles bend and get into the space between the gum and the tooth. Extra soft brush. Now this one really does a good job. Those bristles bend, conform to the surfaces of the tooth. They go in between quite a ways. That will do a really nice job of getting in between the teeth and getting things clean. I also have here a Sonicare toothbrush. Of the electric brushes, this happens to be my personal favorite. I'm not going to use this one on the Typodont because I use this one in my mouth and I want it to stay clean. Oral-B Braun brush also is a good brush. What I like about this particular brush is it has a 2-minute timer, so you know for sure that you brushed long enough. And it also is sonic. The bristles vibrate, and when you're done, it feels really nice. It feels like you just had your teeth professionally cleaned. But you don't have to use an electric brush to do a good job. If you use a soft brush or extra soft brush, those bristles are going to bend. They're going to go into the spaces between the gum and the tooth. They're going to remove a lot of the bacteria and a lot of the biofilm and accomplish what you want. They're going to make you look better, smell better, have fewer cavities, and reduce your risk of periodontal or gum disease. So the takeaway is use a soft brush, not a firm, not a medium brush, and brush along the gum line. Thanks for listening. Brush to your health.